Bismillahirrahmanirrahim. Today we will discuss how to teach a medical student an ECG strip. It is a very important topic, so we will move step by step. ECG teaching. First, introduce yourself to the student, such that I am Dr. Muhammad Abbaskhan, ED registrar. May I confirm your name and age, please? So the student will confirm his identity that I am Mr. David and I am a final year student. So after that you move further. First you ask what is his basic knowledge. So you can start from that area. No need to waste the time if he already knows the knowledge. After that you ask him what is his question, what is his weak point and what he want to learn. So after that, every time you say something to the student, you ask him to repeat what he said, what you said. For example, in the ECG, first we consider the P wave. P wave is shows the start of depolarization in the SA node. So the PR interval is normally 5 small squares. So you will have to say him repeat after me. So the student will say that a normal PR interval is 5 small squares. So, and the QRS complex is normally 3 small squares. So repeat after me. The student will say the normal QRS complex is 3 small squares. If the QRS complex is less than 3 small squares, then it is called narrow complex tachycardia. So repeat after me. If the QRS complex is less than 3 small squares, it is a narrow complex tachycardia. ST segment elevation. If there is a 2 millimeter 2 small square elevation in the ST segment in the chest lead, it is myocardial infarction. And if it is 1 millimeter elevation in the limb leads, it is myocardial infarction. Repeat after me. So the ST elevation in the chest lead is 2 millimeter and it is myocardial infarction, and in the limb leads, if it is 1 millimeter elevation, it is myocardial infarction. After that, if you ask the student that there is a T wave and it is the T wave comes after the QRS complex. After that you will say to the student that the heart rate can be found by measuring the QRS, the interval between the two R waves. So if there is a three big squares between the R interval, then you divide the 300 by 3, so it will be around about 100 heart rate. But it is only for the heart rate when it is the ECG rhythm is normal. So everything you say to the student, then ask him to repeat after you. So there must be an interaction between you and him that also has marks. So he is a medical student, you have to interact with him. There should be no monotonous teaching. After you are done, you ask whether you understand or not. So you have to find out whether he has learned something or not. So after that you ask him any question. You encourage him to ask a question. After that you tell him, during my stay, if any question, I am always available. So you must give him future agenda. So what will be the future agenda? Next time we can talk about wide QRS complex tachycardia. So there should be a future agenda. There should be no closing of discussion very abruptly. So discussion should not be finished abruptly, such as okay, the lecture is finished and you go that way and the student is the other way. So it should be a good finish. finishing. If the it is very important to know that if ECG is unstable, then say that this patient is unstable, move the patient to the CCU. After that you can teach the student with the ECG. But first of all, the patient safety is very important, and it has one mark. There is one mark for the patient safety. Thank you.